Let's discuss indication for surgical intervention in hyperparathyroidism. Okay. So I have taken tables from Sabiston and Bailey. So the indication for parathyroidectomy in patient with primary hyperparathyroidism. So in primary hyperparathyroidism, and so the indication are if the patient is symptomatic like renal, bone, neurocognitive, neuropsychiatric symptom. Okay, if the calcium is more than 1 mg per dl above the upper limit of the normal, and the age is less than 50 years, less than 50. Okay, and bone mineral density T score is less than 2.5. So calcium is more, age and BMT is less than 2.5. Okay, so it's a sign of osteoporosis or significant reduction in bone mineral density. Okay, then vertebral compression fracture on spine imaging, or if the GFR is less than 60 ml per minute. Okay, and nephrolithiasis or nephrocalcinosis. Okay, or hypercalciuria with increased stone risk. So in urine calcium more than 400 mg per day. Okay, and when active surveillance and routine long term follow up is not a good option. Okay, so calcium, you have to remember two value. Calcium is more than 1, serum calcium is more than 1 mg per dl, or urine calcium is more than 400 mg 20 over a day. Okay, okay, so in same thing given in Bailey. So here it is mentioned the asymptomatic cases of primary hyperparathyroidism, the surgical indication. So serum calcium more than 0.25 millimole per liter or 1 mg per dl above the upper limit of the normal. Okay, so this new value 0.25 millimole. Okay, okay, and that BMT is same, everything is almost same. Here 24-hour urinary calcium is more than 10 millimole per dl or more than 400 ml per day. Okay, here it is mentioned ml, I think it's wrongly mentioned, mg should be there. Okay, and increased risk of stone formation, and everything is same. Okay, okay, so let's go to the surgical intervention in secondary hyperparathyroidism. Okay, so here they divided into essential component and clinical finding. We will focus on essential component. Okay, so PTH level more than 500 picogram per ml, hyperphosphatemia, serum phosphate is more than 6 mg per dl, or hypercalcemia, so serum calcium is more than 2.5 millimole per liter or 10 mg per dl. Okay, and refractory to medical management. Okay, so it is serum calcium, it is bit different from the primary hyperparathyroidism. So it's a secondary. Primary, you just remember serum primary is 1, secondary is something related nearby 2, secondary is 2. Okay, okay, and the volume of largest gland is more than 300 to 500 millimole per cubic, or long axis more than 1 centimeter. Okay, so in clinical finding there are long list. Okay, like severe osteitis fibrosa and subjective symptoms, progressive ectopic calcification, calciphylaxis, progressive reduction in bone mineral content, anemia resistant to and ESA, and dilated cardiomyopathy or cardiac failure. Okay, So next, surgical intervention in tertiary hyperparathyroidism. So in tertiary, there is subacute severe hypercalcemia more than 3. So you just remember, in primary it was more than 1, in secondary more than 2.5, in tertiary it is more than 3 millimole per liter. But you have to remember the value unit also. Okay. And impaired graft function, nodular hyperplasia of parathyroid gland, and progressive symptom more than 2 years following transplant. Okay. So transplant, even after transplant, the symptom is continue to progress for more than 2 years, like worsening bone disease like pain, fracture, bone loss, renal stone, nephrocalcinosis, soft tissue or vascular calcification. So this was bit confusing, so I tried to compile all three regarding surgical intervention in hyperparathyroidism. Thank you.